Hi, I'm Dr. Urvisha, pediatric dentist based in Mumbai, and today we are going to discuss. For your front teeth, you can lift the lip and check. In my cases, the defective enamel usually appears extra white, but the surface is otherwise normal and intact. There is no breakdown of tooth structure. The child may have some complaint about the aesthetics, otherwise, he is asymptomatic. In moderate cases, the lesion typically has a creamy yellow appearance and the surface breakdown has just started. There may be some decay. The child may complain of sensitivity and pain, as well as aesthetically it doesn't look very nice. In severe cases, the lesion has a typical mottled brown color in appearance and pothole formation has started, sometimes even before the tooth has finished erupting completely. There's decay at an advanced stage, and the child complains of extreme sensitivity and pain and refusal to brush the surface, and looks wise, they look very ugly.